Good morning, board members. On March 11th, the PHO of BC ended mandatory masking in many places, including public transport, which I believe was a grave mistake. I, like many other people, rely on public transport. I don't drive and I don't own a car, and I've been happy to do so for many, many years and intend to continue doing so. But now that masking is optional, the use of public transport is a health risk for me. It is not a safe place to be. I am not alone in this risk. Everyone is at risk and no one is immune from exposure to COVID. For some of us, the consequences of exposure to COVID may be fatal and may even result in hospitalization or death. And even for those who are asymptomatic or have mild symptoms, medical studies show that COVID is a multi-system disease affecting multiple organs. We have yet to really understand what the long-term effects of having COVID are and what the impact will be on society as a whole. Masking is one proven and effective way that we know to keep the transmissions low of this virus. On the WHO website, it states, quote, "Masks should be used as part of a comprehensive strategy of measures to suppress transmission and save lives," unquote. Masking needs to be done collectively and en masse for it to be effective. If I mask up and you do not, I am at risk and you are more greatly protected. Given this, I would like us to seriously consider how we have gone from we're all in this together to it's a personal choice with regards to masking. Not everyone on the bus or train is fully vaccinated or vaccinated at all. There is no, there is no guarantee no passenger on the bus or train does not have COVID. Buses and trains are often crowded, the air quality can be poor, and with the numbers being drastically reduced for those who are getting PCR testing for COVID, we don't really know what the actual numbers are of those who have COVID. We need to protect each other. We know that a variety of people use TransLink services, and they include the most vulnerable of our society, low income, poor, the elderly, students, Black and Indigenous peoples, people with disabilities, the immunocompromised, those who live with or care for those who are vulnerable to COVID. They include people who don't have the luxury or means to drive a car to isolate themselves from the potential of harm. Getting the bus or train knowing everyone is masked means that you don't have to rearrange your schedule to find the least crowded time of day, to get to the pharmacy, to get your medication, to get to the grocery store, to get your food, just to be safe. It means you can get on anytime, relax, maybe look out the window and even dream. It means you don't have to isolate at home because you are immunocompromised and can safely visit that great friend that makes you smile and have a belly laugh. Getting on the bus when everyone is masked says, we're all in this together. Masks are mandatory on public transport in Saskatoon, in Alberta, in Quebec, in Ontario, and UBC is doing its own mandatory masking on campus. I urge TransLink to model leadership to provide a safe and essential public service by mandating the wearing of masks on all public transport, to enact leadership where care for one another is a top priority and no one is left behind. Thank you.
Thank you very much, Joy, for coming to speak to us today.